Hello, everybody, and welcome to today's episode of the Everyday Woman podcast. I'm your host, Nyahangalea. Thanks for joining. Today, we will be talking about my postpartum journey. I will be going through pretty much a little tidbit of during the pregnancy, and then mainly it'll be what happened postpartum, like after I had the baby. So, I have a teenager already who's 13. Then I got pregnant 13 years later. That's a whole other situation right there. But then I had my baby early. He came early, so he came at about 35 weeks. And I was home, my water broke. We went straight to the hospital. Got to the hospital, which is where I was supposed to deliver anyway. So that's the hospital my OBGYN practices from. I did have pregnancy complications. That's a whole other story. I had hyperemesis gravidum. That's what it's called. So if you have morning sickness, now morning sickness is big brother, he's or her big sister, everything just amplified. So every day, 24/7, stuff goes in, it comes back out. So that's what I had to deal with as far as during the pregnancy. So I had to stop working. I had to have fluids at home. I had to administer IV fluids to myself at home. I needed a PICC line, which is a central line. I still have the scar from the PICC line. I'll post some pictures of that. So I was already stressed out, having heart palpitations, needing to see a cardiologist. So those issues were already ongoing. Well, now 35 weeks, my water breaks. 35 weeks, my water breaks. And we end up at the hospital, right? So we go into the hospital. First things first, I'm planning to get an epidural because, I'm not trying to do that by myself. So we go in. They try to put in an IV. Couldn't. I got stuck, with a needle a total of 7 times. In a lot of pain. Didn't get an IV in. We were there. I was in pain. Moms, people who've had babies. I was in pain. Pain, screaming. Oh gosh. And then couldn't get an IV in, right? So they're like, okay, they have an IV team. This is like at the hospitals, people who would come in, put a PICC line or put a line in, whether it's anesthesia, because your heart sticks. So in my situation, they were waiting for anesthesia to come in to put an IV in so I could get an epidural. I guess it was so busy, right? This is not making excuses, but it didn't happen in time, right? OBGYN comes with the doctor's office. She comes down and is like, she's like, well, how far is it or whatever? How far is labor going? How long have you been laboring? And, she was like, well, you might have a little bit to go. And I'm like, can you please do an exam? I want to know how far dilated or whatever I am. So 10 is fully dilated. She did the insertion, what they do in OB. I don't know the terms so well. I'm not familiar with OB, but I guess she did a finger, whatever, examination. She said I was 8 centimeters dilated, which is pretty close, right? She had other laboring moms, so she was like, I'll be back, right? I'm there, still in pain. And she kind of was like, well, you have some time. By then, Mr. Anesthesiology guy comes by, is behind the curtain, and they're like, well, she's 8 centimeters, so I'm guessing it's too close or too late or whichever. I feel excruciating pain. It's like somebody is ripping me from up here down. It's like somebody just grabs your organs and just is yanking it down. Supposedly that's what they call when the baby's dropping or when the baby is going into the delivery canal thing. Now it's too late. I'm like, I need to poop. So I was like, I got to poop. I guess I got to poop was the word, right? Because I said I got to poop. They're like, oh, the baby's coming. The baby, we're about to deliver a baby. Now everything goes crazy. Doctor's nowhere to be found because, she went somewhere else. I'm screaming, grabbing my husband's husband. What do you want me to do? Do you want me to hold your hand? I was like, hold my hand, but don't hold my hand. But no, don't rub me. No, don't touch me. Like, I want you here, but I don't want you here. He's looking confused. I'm in pain, excruciating pain. I just feel like I need to poop. So now somebody's down there is like, okay, no. A nurse was up here and was like, you need to wait for the doctor to come. I'm like, wait for the doctor to come? I'm not waiting for do I look like I could wait for a doctor to come? The baby's not waiting. Whatever is happening is not waiting for a doctor. Then I start pooping. Well, so they're like, well, or whatever. I feel, we're going there, okay? I just feel a gush of come out. I feel ripping, searing. I just see the doctor coming right away. And she just sits right down. It's like down there. And I feel the ring of fire is what they call it. Oh, God. Baby's out. I thought I was dead. I literally thought I was, because I just lost, I guess I was about to pass out. I don't even know, but I was looking up. I saw something. I don't know what I saw. I was like, yeah, this is it. This has to be it. There's no way. And then I hear the baby crying. They try to put the baby on me. I'm too weak to even, I'm just like this, like, how moms would be like, oh yeah. No. I was just like that. I kind of looked down, and there was just fluid and blood and stuff everywhere. And I had ripped. I guess it was a second or third degree. It wasn't a really bad tear. I need to look this up. It was a second degree, a tear from my vaginal area. So doctor's down there stitching it up. Husband's over there. They're like, go check on the baby. Somebody was telling him to take pictures because my husband's not a picture taker. So I was like, thank God for the nurse who told him to take pictures. I wouldn't have had pictures of the baby newborn. Okay. Now fast forward. Okay. Room becomes available. We move up to the hospital room. We're in the hospital room. Day 1 with the baby, the usual postpartum stuff, trying to breastfeed. Milk isn't coming in, but just keep breastfeeding because then the milk will come in. This is kind of draggy because there's no good part because it's not good, but this is the intro to the good part, the good, not good part. So now we come home. I guess I was already sleep deprived from the hospital, right? So we come home, I'm trying to breastfeed. I'm trying to exclusively breastfeed because I'm an awesome mother, like duh. So exclusively breastfeeding. Every time baby wants breast, it's on me. Every time baby wants breast, it's on me. And then I don't have enough milk production yet. So I'm not trying to confuse my body because they say like when you pump, then your body is like, wait, do you need too much? Do you need so it's like have the baby breastfeed, so your body kind of knows how much to provide for the baby, right? In Africa, they say a mother is at door's death for like the first 30 days after she has a baby, which makes sense. Like they'll say it in like a traditional way, as in all hands on deck. Mom barely does anything. Like mom is treated like a patient, which it should be, because if your baby's healthy, the baby comes out, baby's healthy. Baby's just going to go through the developmental stages that babies go through. Really, it's the mom who has been through it. Baby came out healthy, baby is fine. It's the mom who should be taken care of. But, not just, because if the cultures are different, or because if you don't have enough help, then it's really harder to do that. I didn't have a problem with having help. It was just like I was trying to be mom, like, oh, I have to do this, I have to do this. So by day 3, I was just starting to feel off. Something just felt off. This is day 3 home, but like day 6 postpartum, I was like, I just feel something's off. I start having like my heart's racing. I'm having all these sensations of like, something's not right, because that's not how I should be feeling. Okay, well, you just had a baby, blah, blah, blah. I call my doctor's office. I was like, I'm not feeling okay. I go down the Reddit hole, because that's the hole you always go down, right? Let me Google something on social media hole. So I go on social media and I start seeing things of like postpartum anxiety, and I'm like, oh, I can't have postpartum anything, because I hear people say postpartum. They'll just say, oh, she had postpartum. Postpartum is a lot of stuff. A lot of stuff could be postpartum symptoms. not physical. I'm talking about emotional, mental, postpartum symptoms. So then I go down this rabbit hole. I'm like, ooh, I'm feeling anxious. I'm feeling, something's off. Call my doctor's office. Over the phone, the lady is like, oh, we can call you in some Xanax. Because I was crying. I'm crying, and I'm just like, I'm not feeling bonding with the baby. When it's time to breastfeed the baby, it's like a feeling of doom. I'm just like, every time he breastfeeds, it makes me feel sad, and I'm crying, and there's postpartum, there's baby blues. So the doctors, the nurse line, it's kind of like, well, that's something that happens with mom, baby blues. But it didn't feel like baby blues. Baby blues, I guess, feels the same way, but something in me just told me this is more than baby blues. So they were like, okay, well, we'll call you in some Xanax, and you could take, and I was like, and I'm not able to sleep. So they called in some Xanax. I'm like Xanax? The stuff I'd be like, that person needs Xanax. And I'm like, I'm not taking Xanax, but whatever. Doctor calls it in. I'm like, I called the doctor, said I'm not feeling okay. They're like, give her some Xanax. Okay, I didn't take the Xanax. Next day, still not feeling okay. Call the doctor's office. I'm like, something's not right. And then, forget the Xanax. Next night, I can't sleep, hyperventilating. My feet are swelling. So I go into the emergency room, and I'm like, okay, I need to go in to get checked out because again, I'm feeling short of breath. I was feeling short of breath. My legs were swollen. Go into the emergency room. Did not have the baby. Oh, the baby's home with my husband and my mom. So I go into the ER. In the ER, they check my blood pressure. My blood pressure is like 160s, which is high. I'm like, normally my blood pressure is in the hundreds. Tell them I'm postpartum, like I'm 6 days. I was like 6 days after having a baby. So, I'm thinking that's going to be a red flag. I'm short of breath. So, again, I'm thinking so many things. It could be like I have a PE. Not that I had a C-section, which puts you at more risk of a blood clot. But I'm thinking I have like something going on serious. I'm short of breath and I'm swollen. So I'm sitting in the ER like 3-4 hours. A lot of people are sitting in the ER that long, right? So, but I'm thinking my blood pressure is a red flag. I would think they would have pulled me back. I overhear the charge nurse, the nurse in charge of bed placement. And I'm saying these terms because I worked as a nurse. I worked as an ER nurse, so I kind of know the terms. But I'm there as a patient. I'm not even thinking like I worked in the ER or I know what these terms are. But somebody goes, well, she's postpartum. Should she go up to the OB floor or should she stay down here? Well, they call the OB floor. I guess OB floor was kind of like, nah, she should stay down here. I don't know what their policy was as far as where somebody should be treated and within what window you should go to the OB floor. Because if I had gone to the OB ED, I would have been seen right away. They don't have like a high weight volume like the regular ED. So I'm sitting in the regular ED, short of breath, hyperventilating, crying, emotional, breast swollen, trying to pump. I don't have somewhere to pump. And I overheard somebody, because they called me to get registered, right? So I'm talking to the registration lady crying. She looks at me, it's kind of like, oh, it's okay, right? Somebody tells the ER charge nurse, well, the charge most times is in the back. So I guess it's whoever was doing bed placement. Tells them like, she's postpartum, blah, blah, blah. And I overhear her say, well, we could have fast-tracked her if she had the baby with her, but she doesn't, right? So she says that, and I'm just like, bro, like, what does me having the baby have to do with how I'm feeling? And I'm just crying, and I couldn't. My episiotomy starts bleeding. I'm changing pads because I have my episiotomy as in stitches in my vaginal area because I had the cut from having the baby. So I'm sitting there in the ER crying, blah, blah, blah. God forgive me, because like when you go to the ER or the hospital and you see people who are like, especially in the emergency room, they're like, just walking, pacing, crying. It's kind of like, well, you're alive, you're crying, you're pacing. So obviously like if you were that bad, you wouldn't be able to be doing all this kind of. It looks like, oh, it's the dramatics, because I'm in healthcare. I've heard it said like, oh, they must be drug seeking because they're here bawling. Like, who? Like, you're doing the most. This is the public. Like, go sit down somewhere if you're in so much pain. Why are you pacing? I literally looked like one of those patients that people would think like, oh, if you're in so much pain, why are you up and down crying? Obviously you're doing fine because you're walking. Or, oh, I can't breathe. Obviously you're doing fine. Obviously you can talk so you can breathe. Because that's the other thing I've heard. Like, oh, if you're talking, then you're breathing. Obviously, but they're short of breath. Like, I can't breathe doesn't mean my esophagus is closed. Obviously, they can't breathe at all, but it's like I'm struggling to breathe. In the moment, you're hyperventilating. Those are the words that would come out. So I'm just pacing and still waiting in the ER, crying, calling my husband, crying. The baby's at home, breast is swelling. I need to pump. So I called my OB-GYN, because I'd already called them to say and they said come in, because I called with the symptoms and they said come in. So I called the office and I'm like, I'm in the ER. I need somebody to see me. Like, I need to be seen, even if I'm not seen in the back in the ER, like because the OB-GYNs, their office was upstairs, just because. In hindsight, I know they might have deliveries because they have a provider who's on call for deliveries and stuff like that, but they have providers in office. So at this point, I'm just like, can I just come to the office and be seen? Because the office is upstairs. The office is in the same building, third floor, ER is on the ground floor. I'm like, I just need somebody to see me. So I call, they were like, well, the doctor is in it with a patient, blah, 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 blah. Okay, fine. I call again because I don't know what to do. Like, healthcare is just, I don't know what to do. I don't know what to do. So I call again. Something must have happened. Something happened. Obviously, calls were made. Thank God. It's not about being special or whatever. But at this point, I'm like, something's not right. Like, something's not right. I'm not more important than whoever else is sitting in this waiting room, but something's not right. So I call again, and I'm just like, I need somebody to see me. So I'm guessing the provider on call, one of the providers must have called the back line, because it didn't even take 5 minutes after I called for like the third time that I was pulled into the back, right? When I go into a room, one of the providers, the OB-GYN providers, comes right away and is like, what's going on? And I'm like crying. I'm like, it's just, I can't sleep. I can't breathe. Like, I have to sit up to breathe. Like, I can't sleep. You could see me bawling, just hyperventilating, just. So he goes, okay, I'm going to prescribe you some Zoloft for, like, Zoloft. I was like, Zoloft? Like, what, like depression medicine, Zoloft? He's like, yes. I'm like, what? No. That's not what this is about. No. This is, I'm like, I'm swollen. My legs are swollen. So he touches my legs. I have, at this point, edema is measured in like +1, 2, 3. I had like a +3 edema. He's like, well, after you have a baby, there's swelling, like your body, the fluids, that this is kind of expected, is what he told me, the swelling. And with the shortness of breath, he's saying like, that could happen. Your body's still trying to figure itself out. I'm like, something's not right. So it's like, okay, well, we're going to run some tests, but it should be okay. And like that, I was like, okay, let's forget your Zoloft you're trying to put me on. Like, depression medicine for me, you have never seen somebody happier than me. This is just a thing, okay? So, okay, scrap that. He leaves. ER doctor comes in, it's like, oh, what's going on, blah, 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 blah. We'll do some tests, same. And I'm still just emotional, just like freaking out. Run some tests, like, next thing I know, nurse comes in, it's like, oh, I have to give you some Lasix. I'm like, Lasix, like the, like water pill Lasix, like, like water, okay, so they do tests, like they do a CAT scan, they do labs. She says, oh, I need to give you some Lasix. Okay, why do you need to give me Lasix? Oh, because you have some fluid overload or whatever. I'm like, why? Okay, because your BNP, and as in Nancy, NP, was high. I'm like, my BNP was high. So BNP is a marker to show like fluid overload. They'll use it to diagnose people with like heart failure and stuff like that, because it's like a cardiac marker. So I'm like, my BNP is high. Oh, now this just takes me over the edge. So I didn't get this news from the doctor. I got it from the nurse. And your CAT scan. So I had, it could be a good thing or a bad thing, we'll see. But I had my chart. So I was on my chart, which is where you could look up your medical records, just looking up my stuff. So I had already seen like my CAT scan, and it showed some pleural, like some fluid in my lungs. And I'm just like, what? And then she comes in, it's like, I need to give you some Lasix. It's going to be an IV push. I'm I was like, what is going on? Because you're getting news on stuff, and it's just, it's just like, oh, you have some fluid, you have fluid in your lungs. Like we just need to give you BNP. If BNP is really high, it could be like a sign of like heart failure and stuff in some people. So my BNP is high. I have fluid in my lungs. My legs are swollen. Nursing mind, I'm automatically thinking, am I going into heart failure? Because there's this thing called postpartum cardiomyopathy, which women can have after childbirth, where like you literally get heart failure just because you had a baby. Whew. So she comes in, it's like, I need to give you some Lasix. Okay, fine. So I'm like, okay, I have fluid in my lungs. My BNP is high. They're definitely going to admit me now. So she's like, well, we're going to monitor you. Like, we're going to have you pee because the diuretic is going to make you pee. So then that happens. I start peeing a bunch, which is what they expect. Then the doctor comes in, is like, oh, okay, you've peed a bunch. However much they were expecting me to pee, we're going to send you home. And I'm like, you're going to send me home? First of all, you just checked my BNP is elevated. I have fluid in my lungs. Like, okay, I peed, but how do you know it's resolved? How do you know this is not going to be an ongoing thing? How do you know I'm not like in heart failure? Well, okay, it should be better because you peed a ton. I know. As in Lasix always makes you pee. That's just how it works. But how do I know this is not a thing? Long story short, he's like, ma'am, well, it's gonna get better. You can follow up with your OBGYN the next day. Okay, bawling, but I'm happy to be going home to my baby. So I'm like, now I'm actively like, now I'm like, okay, now this is anxiety too. Now because I'm gonna go home. So I'm like, okay. So now in comes the OBGYN. And he goes, oh, like less than 5 minutes. They had brought in my discharge papers to give it to me. And the nurse goes, oh, wait, hold off on that. OBGYN comes in and is like, your liver functions are a little elevated, and that's a concern. So we're going to keep you at the hospital and give you some magnesium in IV. So I'm like, okay, why? What does that mean? Well, we're concerned about eclampsia or preeclampsia. I know, preeclampsia. We're concerned about preeclampsia. Again, I've heard about preeclampsia. That's a thing with, people with, mothers, a postpartum issue, a pregnancy-related complication too. So I'm like, okay. So then I tell the OBGYN, I'm like, wow. And I was being like snarky, but I was also being like, dang, is it that bad? I'm like, so they'll literally send you home. I was like, so you literally have to be actively dying to get like the care you need, it seems like. I was like, because the ER doctor was about to send me home. So the OBGYN goes, well, it could have gone either way. And I'm like, as in what? He was like, we're just admitting you as a precaution, but even if he had sent you home, it would have gone either way. It wouldn't have been like it could have gone either way, is what he said. Now in hindsight, as a healthcare provider, he's not trying to throw the other provider under the bus. So he goes, well, it could have gone either way. But you're about to admit me now based on you looked at the liver function, which he saw, which the ER provider also saw. So does he not know that preeclampsia is something concerning for a woman as far as also after they've had the baby? And did he not see my blood pressure was in the 160s and the liver function was elevated? Like, I didn't know. And I'm a nurse. I've been a nurse for 13 years. I didn't know because I've never worked OBGYN. I've heard about preeclampsia, but I don't know what I must have studied it in nursing school, but I don't remember what the markers are, what the red flags are. I knew the fluid and the BNP and stuff like that because I worked in med surg and the ER and did some IMC, did some step down ICU stuff, but I didn't know what the OBGYN stuff was. So then I'm like, okay, I'm going to get admitted. I called my husband, I'm going to get admitted. Can you bring the breast pump? Now my baby's at home by himself, 6 days. I had started pumping like 2 days before because I wasn't pumping before. So there was some milk at home. No, I take that back. I hadn't been pumping. Sorry, this is for the second situation. I had not been pumping, so there was not milk at home. I brought a pump with me to the hospital. I pumped a little, so my husband was gonna. I brought I didn't have the manual pump yet. I brought a pump that I had, the automated one. It was like a cheap one. It wasn't even pumping well. Brought it with me, so I told my husband, well, come get the milk that I have, the little that I have, and then I'll try to pump more. I literally had like maybe 8 ounces. That wasn't even going to serve him much. But anyway, I got admitted. Again, I got admitted in this little, not a bed behind a curtain situation, because there weren't beds available at the time, which is fine. It was cold though. So I'm there. They put in a catheter because they have to monitor with the magnesium infusion. So I'm still in this behind the curtain situation going on. So I had to be monitored closely, as in intake and output with the magnesium sulfate. So they put in a catheter and started the magnesium drip. And I called my husband on FaceTime. He's trying to give the baby a bottle because now that he ran out of it was just 2 feeds, and the milk he had collected was outright. So he's like, well, I'm trying to give him, we bought like Similac sensitive just to start, just because now there's no food, so now you have to just give him formula. So the exclusive breastfeeding plan, that's out of the window. I'm at the hospital on video with him. He gives the baby the bottle. He does like maybe like 1 ounce, 2 ounces. The baby starts projectile vomiting, like our newborn, like 6 days old. I'm looking on camera. The baby is projectile vomiting. My husband's trying to control the baby, hold it. I'm like, babe, hold him up, because we both haven't had kids in like over 8, 9 last time we were parents, years. So I'm like, hold the baby up, like hold him up, do this. I freak out, right? Because as a mom, I'm like, I have food for my baby here. My baby's over there. Like, no. So I'm thinking like, okay, well, the doctor said it could go either way, right? Like you could have been admitted, you could have not been admitted. So I'm like, okay, this is not working. I'm there. I start freaking again. And I'm like, okay, I got to go feed my baby. That's all that's in my head. I call the nurse. I'm like, the doctor did say it could go either or way. I need to go feed my baby. Like, I need to leave. I need to leave AMA because I'm a nurse and I know the terms against medical advice is AMA, right? I didn't get any medical advice. I just told her from the get, I need to leave AMA. So she calls the doctor. It's like, oh, the nurse said the patient said she needs to leave and she's going to leave AMA. Doctor's like, okay, she can follow up at the office with us. So this is on was it Wednesday? I think it was a Wednesday. Yeah, I think it was a Wednesday. Like, it was like overnight, like about midnight. My husband doesn't know I'm coming. I sign out, take the catheter out, remove the magnesium. They check my blood pressure. It was fine. At that time, it was like 120s, 110s, 120s. I get in an Uber because I didn't even want to tell him because I didn't want him to say, oh, we'll figure it out, because I'm thinking my baby needs to eat. Get in an Uber, barely walking, painful as hell because I'm just hurting everywhere, stitched up. Get in an Uber. I'm knocking on the door at the house. And he's like, who's that? Because it's like after midnight. Opens the door. He's like, what happened? I'm like, I had to leave. I had to feed the baby. Man, I saw relief in this man's face because he was so worried too, I think, as far as what's the baby going to eat if he's throwing up whatever you gave him. Put my baby on my breast, latch him. I'm like, I'm thinking to the baby, I'm not letting my baby go. I'm not leaving you. I'm like sitting there like breastfeeding him. And then I make an appointment to see my doctor on Friday in 2 days. So here I am. Same. Now I'm like, okay, if I go in on Friday, I'm sure they're going to admit me then. But until then, I'm going to be pumping. So I'm pumping because I wasn't trying to pump initially, right? I'm like, I don't care. Body could be in chaos. If it produces too much milk, I'll just pump again. So I'm pumping, getting ready to go in. Friday, I go in for the doctor's. I go in for the appointment at the doctor's office. This time, I'm coming in, coming in hot. I'm like, okay, here's the thing. my BNP was high. How do I know I don't have cardiomyopathy? Because when I came in, you were like, oh, it's just regular fluid overload from postpartum. Next thing we know, my BNP is elevated. I have like fluid starting to build up, traces of fluid in my lungs. And then he was like, it was like, okay, she's coming. I was like, yeah, no, I need to know what's going on, blah, blah, blah. He tried, though. He tried. This is a different doctor in the practice, but this is the same one who told me that, it was like, oh, just regular fluid buildup from postpartum. So I'm like, how do I know that you are right? And blah, 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 blah. And he calls a cardiologist's office, see if they could see me that day. The ones in the building, they couldn't. Called one like maybe 20 miles away. They could see me that day, but they weren't sure if they could do like tests and stuff like that. So he was like, you know what, to make it easier, just go back into the ER. And I will call them and give them a heads up so you're not even waiting too long and stuff like that. Which honestly, if they have emergencies, other people are going to go ahead of you. Your doctor calling to get you in sooner is not really, it's not guaranteed, but it was, I think it was a good time. So I did wait, obviously. It wasn't a long wait as the previous day. I got into the ER. They did like follow-up BNP. The BNP was lower than what it was 2 days prior. Yes, the liver function was coming down. The blood pressure was still elevated. My liver function was coming down, and the BNP, as in the fluid overload marker, was also coming down. So she came back in and was like, I was like, I'm here. I have all my stuff. I had all my stuff to be admitted because I was like, okay, now I'm going to get the McNeil. But she was like, well, your stuff's better, so we're going to send you home. I was like, wait, no, I'm ready. I'm here to be admitted. Like, I have everything in place. The baby has so much. He has enough milk for like 2 days, and I'll just keep pumping when I'm here. And she was like, oh no, you could go home. Like, you're fine to go home. So I was like, oh, thank God. Okay. I'm feeling better. Okay, I could go home. So I go home that night, and it starts again. I can't sleep, panicky, just restless. My husband's like, babe, you went to the ER and they told you everything was fine, right? So this is at like 2 a.m. I'm pacing. I'm like, I can't sleep. Go sleep. I'm sitting up there trying to say, I'm like, something's not right. Pacing in the bathroom. He's like, but what do you want me to do? I'm like, I don't know what I want you to do, but something's not right. Something's not right. Freaking out. And then I go, and I think he had the baby. I gave him the baby or something because I was like, you just need to take the baby. I'm pacing the house. I go into the bathroom, and then I wake up in the hospital because I was in the bathroom. That's what I remember. Next thing, I woke up in the hospital with like people all on top of me, like a lot of people, like room full of people, and I couldn't talk, and I'm just like, what the hell? Like, there's people everywhere. I'm at the hospital, but I'm like, did I look at my belly? I'm like, did I have the baby yet? Am I having the baby? Like, I can't remember if I had the baby or not. They're talking to me. I can't talk. Like, I literally cannot talk. I'm trying to talk. Like, I'm signing and I'm trying to talk. And I just keep hearing them say seizure. She had a seizure. She had 2 seizures. She had a seizure. She had a seizure, and I'm like, what is going on? I'm trying to tell them. I kept pointing to my ring because I'm trying to look for my husband. And then I see him come in. Thank God. And I'm just like, what's going on? And he's telling them like, oh, she said something wasn't right. And next thing, she was having a seizure. And he's explaining all this stuff. And he said he called 911. And then now we're at the hospital. And so now I have eclampsia, which is what happens when preeclampsia is out of control. So I had a seizure. Now in hindsight, I had a seizure at home, in the bathroom, and my husband called 911. I was taken to the hospital. Then I had another seizure. I figured I was taking the hospital on a stretcher, and I found out that I had another seizure. So I was taking the hospital on a stretcher, And I don't know if there was a room or there wasn't a room, but I wasn't in a room because I had a seizure in the hallway. Then I was automatically taken into a room because that's the room I woke up in. And then now I hear, oh, she had another seizure in the hallway. I don't know if I just came into the hallway and had the seizure right away, or if I was in the hallway. In flashbacks, things are starting to come back. Like now, I'm starting to have flashbacks of some things that I didn't remember at the time. Months later, I'm starting to remember some stuff like after the seizure that I couldn't remember. I don't remember when I started talking. I think it took a few hours, and that's, I guess, side effects of a seizure if you have a seizure. And that's when after that, that's when the journey started. That's when I think my postpartum journey started, after that seizure. So we'll talk about that more. Yeah. We'll talk about the mental health stuff that developed from that episode of having that seizure, those seizures, and being admitted to the hospital. Obviously, I'll be admitted this time, and now it's a full-blown postpartum issue. But yeah, that will be part 2. Okay. But yeah, having a kid is such a blessing, and it comes with some things. We'll talk more.